Right now, we have a gap between acute care, so the hospital settings, whether it's having to be admitted onto an inpatient mental health unit or repeatedly going into the emergency department, and then what community services can offer.
Step Up, Step Down is a 6 to 8 week DBT dialectical behavior therapy intensive program where our clients are doing 2 DBT groups a day, as well as individual therapy, occupational therapy sessions, family therapy sessions, as well as a weekly art therapy group. So it's a really well-rounded model where we're providing very high quality care to our youth and making sure that we're setting them up for the highest level of success as possible.
Our program is meant for, clients who hospitals might be discharging, but they're not still ready to go home, right? You're stepping down from that really kind of high level service, or you're stepping up from the community, whether it's from your home or from outpatient care or other live-in treatment programs. The majority of clients that we see are the ones with suicidal ideations or past history of suicide attempts or self-harm behaviors. So Step Up, Step Down has really put in the resources needed to better support that group. So we can take that higher acuity client that hospitals typically do not accept and provide them 8 weeks of treatment, and by doing so allow them to transition safely back home. What you typically see is this group is just always going to the emergency department over and over and over, but never really getting that need met. And then when they're done with Step Up, Step Down, we then assess do they need further treatment. If so, they move into our live-in treatment programs for another 6 months, or they go back home where they receive the phase 2 of treatment, which is our outpatient team meeting with them, once a week, continuing that DBT work and really working with them and the family to replicate the learnings that they made on Step Up, Step Down, but in their home environment.
This is a bridge of mental health services. So we're bridging the gap between acute mental health care and community-based programs.
To know that there is a program like the Step Up, Step Down program to sort of stabilize those youth, if they have just literally maybe come from the hospital post a crisis or anything of that nature, they can receive treatment there, and then sort of once they're more stabilized, continue to receive services in a more long-term program like live-in treatment. The bridge has sort of been that common word that we're using here with Step Up, Step Down. If they do require, more service, and if they have options, even just within Youthdale after the unit. So the unit does a great job of that stabilization piece and then finding them a pathway even after that.